Welcome back to the Foundation for Free Enterprise Education's Speaker Series. My name is Michelle Warofka. Today, I am joined by Mr. Dan Pietrusinski. Dan is the Senior Supply Chain Consultant for Empiric Health, a company that has revolutionized the healthcare industry. Empiric Health is an artificial intelligence-powered clinical and analytics company that focuses on identifying unwarranted clinical variation in the healthcare systems in order to ensure patients receive the safest, highest quality care while also reducing the overall costs. Welcome, Dan. Thanks so much for joining me today.
Happy to be here.
Thank you. Yes. Now, pretty neat. As I was reading that introduction there, it sounds fascinating. It's kind of like, the healthcare meets technology world. So, yeah. And I know I kind of gave a very brief description there in that introduction, but Dan, would you mind telling us a little bit more about Empiric Health, what exactly they do, and also if you would mind kind of explaining your role as the senior supply chain consultant for the company?
Sure. Yeah. So, the healthcare landscape it's constantly changing, as I'm sure a lot of us have seen recently with the COVID-19 impact and everything going around that. So, hospitals are constantly needing to find different ways of reducing cost and increasing margin, especially when revenues are going to be lower, especially in the surgery space. So, Empiric Health, we're a startup company, started about 3 years ago, and we utilize machine-based learning concepts with artificial learning capabilities that really help us produce a top-of-the-line technology. And we support, we use that with a physician-centric approach that allows us to go into hospitals and identify really apples-to-apples comparisons of procedures for surgeons and really find where those opportunities are for them to reduce supply costs, become more efficient, and really help the health system be more financially stable coming out of it.
Great. And now your role as the supply chain consultant, what does that actually consist of? What do you do?
Yeah, so my role is to come in and help. There are a lot of different arms. You have physicians that are using the products. You have supply chain that are negotiating prices and working on the operational capabilities. So my role is to come in and really help a lot with understanding what the products are from a medical device perspective and figuring out, I think within with any health system, they can have anywhere from 10 to 40 to 50,000 items they're using, across the system themselves. So I'm able to help provide a level of capability to say, here's what these items are, here's how they fit into your health system, and here's how physicians are going to interpret them. So I offer that, and then also work, with a lot of the other operational and just looking for opportunities more from a supply chain perspective and from a business perspective compared to what a lot of our nurses on our team working with the physicians is looking at this more from a utilization perspective, and you're using this product for this type of surgery. Can you use this other product and get the same outcome, same type of result that you'd expect? So, we're really looking at costs in a number of different ways, both from just the business perspective and then just from the physician perspective. And then obviously a lot of it is overlapping as well.
Wow. Keeps you busy, I imagine.
Certainly does.
For sure. Very good. Now, speaking of supply chain management, if you wouldn't mind, Dan, can you kind of maybe take us back to, your high school years as you were starting to think about life after high school and what your post-secondary plans were going to be? Did you always know that you wanted to go into supply chain management? Because I know that's a major that's pretty in high demand these days. Is that something that you were always considering?
Nope, no idea. When I was applying to schools, and for me it was always going to be Penn State or bust for me, whether that was main campus on State College or if it was starting here in Erie Barron, like it was always going to be Penn State. But I actually tried to, I'm not going to call it game the system, but I put my major down as actuarial science because I knew from Penn State's perspective that if you're a major, you get accepted for actuarial science, you have to start at main campus. And that was a goal for me, was to be able to go to main campus and, get that full experience out in State College. So I started as actuarial science. By the time I got to Penn State and started meeting with advisors, I very quickly realized that it was not going to be a good fit for what I was looking for. And that's where I started to pivot towards looking at supply chain and information systems and other majors that I think would make more sense for the things that I was interested in and things that I was looking to move forward with.
Wow, very cool. And as luck would have it, everything that I hear, Penn State is one of the top schools for supply chain
Yes.
management. So that
Yeah.
move was a good move in your favor.
Yeah, it really was. I think a lot of it came down to just the teachers that you end up getting surrounded with. Like one of my best advisors was one of my teachers up there, Norm Agon, who just I think he was the guy that I was like, okay, I took his class and I started meeting with him individually, and it was like, okay, now I know why I want to do, supply chain. And, it certainly played out well, in my career and with where things have taken me, not necessarily just from a pure supply chain perspective, but then also just kind of preparing for, preparing for whatever gets thrown at me, which has been good.
Well, let's talk a little bit about that then. After you graduated from Penn State with your degree in supply chain management and information systems, you landed, a career, in that path, obviously, and you've gained some great experiences, from these different roles that you played in the different companies. So if you wouldn't mind, maybe kind of walk us through, how it all started after college, and the skills and things that you've gained from those experiences that have helped you with your current role.
Yeah. So I would actually say in terms of trying to understand what a career was and how to build it, I actually started in college doing a couple internships in between years of school. So I had one at Ingram Micro, which is a distribution center, 3PL, who works with a ton of providers. But I started there and actually worked on a second shift distribution schedule, meaning my hours were 4 p.m. till 2 a.m., which really, kind of opens your eyes a little bit to, the different schedules that are out there, and just trying to be, understanding what your role should be. After I did the Ingram Micro internship, I went and interned at Georgia Pacific down in Atlanta, Georgia, working on supplier management. Very quickly you start to understand the differences of big businesses like Georgia Pacific, billion-dollar company, compared to Ingram Micro, a little bit smaller and certainly a different field than what Georgia Pacific's doing. So those two experiences within college were, I think, just enormously valuable to starting to understand, okay, doing this within school, I still have some time left to figure out what I want to do. But it kind of, was a nice little kickstart, especially being in college. When I graduated, I started out at Thermo Fisher Scientific as a transportation analyst, running scorecards, helping some of the directors and managers on our team figure out areas of opportunity to optimize our transportation system at Thermo Fisher. And I spent a year there, figured out that it wasn't exactly what I was looking for, and opened up my job search again, and found the advisory board, who eventually became Optum, just through an Indeed.com search. Did not ever anticipate that I would be looking for something within healthcare. Really was looking for just entry-level positions, and came across that, and eventually started interviewing, and sure enough got brought onto the team shortly thereafter. It never thought I'd be in healthcare, but very quickly found out the type of kind of roles and things I'd be asked to do. My first one of my first meetings, probably 6 months in, I got brought into a meeting with a bunch of spinal surgeons down in Atlanta. And, the consultants on the projects, introducing us, he's like, I'm James. And then he's introducing me, and he says, and I'm here with our spinal implant expert, Dan Pietrusinski. And I'm like, spinal implants? I can tell you, I'm not sure how I'm gonna be able to sell myself as an expert in front of a room full of surgeons who have been operating in this space for years and years. But, it became it kind of set the stage for me as to the amount of preparation and things I needed to do to, be successful at my job, to where, if I'm going to be thrown into a room and need to be able to speak about these products with surgeons who are using them on a daily basis, I need to be prepared and be able to, do the work to understand, okay, how can I position myself to be able to hold a conversation with these people that use these products way more than I do, and not come off as someone that's, just not that prepared. So that kind of first meeting really set up kind of where I knew my career was going from there, in terms of, the consulting industry, and really trying to do the work in the background, understand, what's the best way to solve this problem for the customer. I worked with the advisory board for Optum for 7 years, doing everything from managing people to working with hospitals on any variety of problems, whether that's supply related or process improvements, sitting in on surgeries, watching orthopedic surgeries and watching the staff. Like, I could not have asked for more experience than what I got from advisory board and Optum through those 7 years. But then last year, I felt it was time for a new opportunity, a new challenge. And I found Empiric Health, which is, a very big departure from where I'd worked previously. Georgia Pacific, billion-dollar company, United Health Group, multi-billion-dollar company. And so I came to work for Empiric Health, which is a startup born out of Intermountain Healthcare. And, it's certainly been, it's been eye-opening just to understand the different cultures and different, different capabilities that we're able to do in this space now, working for a smaller company. So it's been really exciting and really fun so far.
Wow, what a ride. Truly. But no, I like, you bring up some great points here, for our viewers, especially who are kind of, sitting here thinking, I don't know what I want to do after high school. And here you kind of knew I wanted to go to actuarial sciences. And then you decide, well, no, this isn't the right thing. I'm going to go this way. And then, as far as you said too, you never thought you'd be in the healthcare industry, and look where you are. And so, you have really, taken all of the opportunities and experiences you can, and been, I'll say, like kind of like a sponge, and have absorbed as much of that information, experience as you can. And that has helped you, to be as successful as you are now at Empiric Health. So that's wonderful. And a great addition. I'm sure you have a lot of great, things to offer Empiric Health. And many more to come for many years, sure. Which is wonderful. Great. Now, Dan, what is it that you love most about your job, or what motivates you, to go to work every day?
Yeah. For me, it was making sure I didn't get in a job where it was going to be the same thing 9 to 5 every day. And, I can say, at Advisory Board Optum and at Empiric Health, that it's anything but that. We're getting thrown different challenges from different customers and clients every day, and need to figure out the best way to prioritize and to figure out what those what those solutions should be. And I think that's really what excites me the most, is that, like, there's not the same way to solve every single problem. It requires a lot of critical thinking. It requires being thrown a problem that I've never expected to have to be able to answer before, and not kind of shy away from saying, I just don't know how to do it, and just figure out, what that answer should be and what's the best way that I can serve the client. So that for me is easily what I like the most about my job, is constantly having those challenges thrown at me. And, aside of that, from just a company perspective, like, culture and environment is something that really motivates me a lot. Like, being passionate about not only what you do, but then who you're doing it for is to me, just, something that keeps me motivated every day. The people I work with at Empiric Health are just awesome to work with, and it keeps you, excited to, wake up and start your, start your day. And working from home full time doesn't hurt either. So it keeps me motivated and keeps me excited about the things I'm doing.
Well, and I can see that enthusiasm in your face, and that's a great point for our viewers. To find something that you're really passionate about, and just throw yourself in. So wonderful. That's fantastic. Now, and you had alluded to this at the beginning about the pandemic that we're all in with COVID-19. Dan, how has COVID-19 changed your role at Empiric Health and Empiric Health as a whole?
Yeah, it's certainly been tough. I mean, our company is focused primarily within surgery. So, we are working with the surgeons that use products on surgical cases. And, when COVID-19 hit, what you saw across most of the country is that almost all of them were suspending elective surgery, which is a huge portion of surgery at hospitals. They're obviously continuing with emergent surgery. If your appendix bursts and you need to have surgery, they're not going to stop that. But for the person that has the knee that's bothering them or the hip that's bothering them and they want to, get that replacement, all of that came to a grinding halt in mid-March. So everything's picked up since then. Almost all hospitals have started elective surgery again, but there's obviously a lot of concerns. Patients have concerns about safety and about the COVID impact and whether I should still have this elective surgery. It's called elective for a reason, because you don't necessarily have to have it done. even if it might, lead to a better quality of life. But there's still major concerns about those patients returning, and hospitals lost 3 months worth of revenue, which you're not going to make that back throughout a year. So reducing costs has never been more important. Being as efficient as you can has never been more important, and trying to figure out the right way to when you're as you're spending items, making sure that you're spending them the right way and don't have, as you said, that unwarranted variation that can lead to more cost than you need. So right. It feels like it's created an even greater importance for the work that we do, and the what hospitals are looking for in terms of reducing costs and finding ways to get those wins, especially when revenue is not as high as it once was.
No doubt about it. This has changed a lot of things. And obviously in the health industry here as well.
Yep.
Now, Dan, kind of switching gears here now a little bit. For our viewers who are watching, many of them, maybe, in high school starting to think about what they want to do. Maybe some people are looking for a career change. But what tips or advice do you have for someone who's looking to go into supply chain management and or information systems that will really help to, give them that leg up?
Yeah. I mean, I think just being prepared for the unknown is really important. I mean, I cannot go back to Penn State and say I learned this specific skill that has prepared me, but I would say from an overall, it certainly learned that like the critical thinking aspect of it is more important than anything else. I think being able to, look at a problem and figure out what's the right solution that's going to, impact all these other variables in the most positive way possible is really the best thing that I got out from my education. I think what prepared me the most. There are certainly skill-based things that have come into play, and just understanding supply chain that are super important as well. But that ability to, just critical think and really, understand the problem you're trying to solve and think 3 to 4 steps ahead based on the decision you're making is the most that you can do and most you can ask for, especially as you're moving forward.
Great. Love it. Great advice. Wonderful. And now kind of along those same lines then, let's talk about the big interview day. Okay. Somebody's out, okay. Any pointers that you could give our viewers that you can offer so that they can really, ace that interview?
Yeah. I mean, I think my perspective on this, and you'll end up finding different perspectives from anyone you listen to about what the right way is to do an interview. So right. Don't be surprised if you find something that completely contradicts what I'm about to say. But at least in my experience with the interviews that I've done that have all led to positive results, like keeping it very conversational, I think is very important. Interviews are not meant to be just that one-way street where they come in, they ask you questions, and the interviewers don't get anything asked of themselves. Especially in my perspective, like things like skills and your education and your experience, are all delivered through a strong resume. I think when they're bringing you in and want to talk to you on the phone or in person, they're talking to you because they want to understand the type of person you are and really like how well is this person going to work with myself or with the company I'm part of, and do I feel like this person can really help our clients be more satisfied in the future? It's not about understanding do you know how to use Excel? Do you know how to, where did you go to school? I mean, they can get all that information, but I think, really selling your personality and convincing them that you are going to be a great person that the company's going to want to work with moving forward is more important than anything else, especially in that interview. So keeping it conversational, asking questions of them mid-interview, not waiting till the very end when the typical, do you have any questions for us type response comes. I think the more that you can try to break up their expected interview and give them something to remember you by, it's going to go a long way to you getting a second interview and eventually the job offer.
Great pointers. And, to your point about, asking questions, that means, do your homework, research the company so that you have, questions to ask during that interview.
Absolutely.
And one of the things that I know from my own personal experience and, to kind of, piggyback that is, to always, a nice handshake afterwards and follow up with a thank you. That always makes a big difference as well.
Absolutely.
Absolutely. Very good. Now, Dan, before I let you go, one more question here for you. And truly, I'd be remiss if I didn't mention this. And that is your involvement in our Pennsylvania Free Enterprise Week program, PFEW, as most people know it by. You attended PFEW as a student when you were in high school. And now you join us for a week each summer, along with your dad, if I may add, to give back to other students by mentoring them through their week-long experience. Why is PFEW so important to you, and why should a young person consider attending?
Well, I would certainly say my attendance helped me want to come back, so many years later. I can still remember going to PFEW back when I was, coming out of my junior year of high school. And really, looking back at it, I couldn't think of a more perfect experience for trying to prepare you for those first days and weeks of the college experience, really getting thrown into, an initially uncomfortable environment with 15 other students that I'd never met before, people I've never seen, not my core group of friends. And, to have the opportunity to, work with them and, be able to, build this company together and do all sorts of things with that group of people. It really, looking back at kind of what my college experience was like and what PFEW was for the week that I was there, it's incredible the parallels that they're able to provide and really give you that opportunity to just understand what you're going to be going through, being away from your parents, being away from your friends, and just going through that new experience. So now to be able to kind of sit on the other side of the table, there's nothing more rewarding than seeing that kind of happen with 15 new students every year and understand that they're going through the same thing that I did, and see them go from not wanting to talk to each other at start when they're first meeting each other to the end of the week where they don't want to leave. So it's awesome just to see what they go through, to see the speakers that come and have such an impact on these students, and just to see how much these people can change throughout the course of the week is really great. I've said to people before that no one leaves PFEW ever wanting to leave PFEW, which is true. So it cannot be a more rewarding thing, especially for students that don't have any camps and don't have anything going on. This is the perfect opportunity to make your summer worth it. So I love PFEW. It's great.
Aww. Well, and we love you. Thank you. And I couldn't have said it better. So well done. Thank you. Thank you for that. And truly, Dan, thank you for all that you do for our foundation. We appreciate everything that you do for us. And I appreciate your time here with me here today. And truly, it was, great conversation about a career field that continues to evolve. So thanks for giving us your overview and for offering some great tips and advice to our viewers as they prepare for life after graduation and pursue the career field of their dream.
Absolutely. Thanks, Michelle.
Absolutely. And if any of our viewers have any follow-up questions for Dan, or if you'd like to connect with him directly, his contact information will follow at the conclusion. Thanks everyone for watching.